Hi, John Armstrong from Advanced Surgical. I'm just going to talk today about mini gastric bypass. And this is a procedure that's becoming increasingly popular in Australia and around the world. It's been around for about 10 years, and in Australia it's been used a lot in the last 5 years. It's a procedure that I use occasionally, and it's becoming an increasing part of my practice. In many ways it's slightly better than sleeve gastrectomy in certain circumstances. In the sleeve gastrectomy procedure, the stomach is made smaller and hence you lose weight and there's an effect on appetite that we don't fully understand. But in the gastric bypass, in particular the mini gastric bypass, the stomach is also made smaller, a bit like a sleeve, but then it's joined up to a slightly shortened small bowel. We've all got about 6 meters of small bowel, which does all the absorbing of food. And in the mini gastric bypass, 2 meters of that bowel just isn't really seeing any food, and we're relying on a slightly shorter 4 meters to absorb our food. So the result is that patients lose weight because they're eating small, but they're also not absorbing so many of the calories and protein that they're eating. I generally don't use mini gastric bypass as a primary procedure, i.e. for someone who's never had any surgery before. I find it very useful for someone who's had a sleeve gastrectomy, maybe some years ago, maybe 5, maybe 10 years ago, and who's battling weight regain. In that situation it's pretty helpful because the patients are still often eating quite small, but they're still able to absorb a lot of calories, and particularly if they have a very sugary diet they do battle some weight regain. Making the small bowel effectively a bit shorter, adding a malabsorption component, allows them to lose weight again and gets them back on track. The other situation that we may use gastric bypass is in the very high BMI patients, patients with a BMI over 50 or diabetic patients. We know that with a gastric bypass, diabetic patients are more likely to be off all their diabetic medications than with a sleeve gastrectomy. Because gastric bypass is a malabsorptive procedure, it reduces your ability to absorb protein and calories. It can also reduce patients' ability to absorb multivitamins, and it's going to be very important if you have a gastric bypass to take multivitamins and attend for regular follow-up. I hope that's provided some information about mini gastric bypass. It's a fairly complicated subject. Obviously, if you were to attend for an appointment, we can discuss this in much more detail.